Good afternoon, and welcome to Dean Richard Barth's final State of the School presentation for the University of Maryland School of Social Work. I'm David Flinchbaugh, Associate Dean at the school, and so very pleased to welcome many of you here this afternoon as we mark a very unique year for our world, our nation, our state, our region, our city, and certainly for our school's history. On behalf of the school's Board of Advisors and the Alumni Association Board of Directors, many of whom are joining us here this afternoon, it's my distinct honor to introduce the school's 7th Dean, completing his 14th and final year at the school, Dean Richard Barth. Take it away, Dean Barth.
Thank you, David. Thank you all for being here today. Well, you aren't here really, but you are listening at some point, so thank you for that. I'd like to acknowledge and thank Interim President Bruce Jarrell, Provost Roger Ward, Deans Natalie Eddington, Jane Kirschling, Mark Reynolds, Al Reese, and Don Tobin for taking their precious time to listen to the state of the school, if you do. I've long been buoyed by your friendship and support. At nearly every state of the school that I have given, the University of Maryland Baltimore has also been represented by our distinguished vice presidents, Peter Murray, Jim Hughes, Dawn Rhodes, Tom Sullivan, and Jennifer Lichtman, who I call on often on behalf of the School of Social Work. Thank you for your support and the possibility that you are listening. I want to express my thanks to all of our virtual attendees, including alumni, field representatives, and students. Above all, I want to thank the faculty and staff of the School of Social Work who created the work that each one of the points I will make is based upon. They're outstanding, civil, creative, engaged, devoted, and consummately professional. I am in their debt every minute of every day. Please join me in welcoming them all, wherever they are, whenever they may view this, if at all. Applause. This state of the school is different from all others in that it is taped, it's brief, and it recognizes even fewer of the many accomplishments of the school. This year is similar, on the other hand, to all others, and that it is an honor to speak to each of you and to all of you who are virtually in attendance. So here we go. First, acknowledgements to Christina Fenwick, State of the School Master, Matt Kahn, our video coordinator, and Clark Shaw Nelson, Dave Pitts, and the informatics team who have also assisted in our event today. All who contributed ideas and images, whether I used them or not. To all those who make this school so well worth talking about, and to those who do not get mentioned but deserve to be. A virtual state of the school, who would have imagined? First, I'm going to give you a sense of the gestalt of the school, as I've done in the past, with images from how the school has felt over these last years. Some 2019-2020 highlights, and a bit about the end of my deanship and my aspirations for my preferment, which is the next era in my career when I hope to focus a little more on what I prefer to explore and a little less on what consternation comes into my inbox every day. What is not in the state of the school? Once again, it is not a comprehensive catalog of all that we are proud of. There is much more to tell. There's no mention of a single thing that we're not doing well, but we're working on those too. This state of the school is dedicated to those who carry the weight of the school on their shoulders and the success of the school in their hearts, and to whom I've given too little acknowledgement. So then and now, the school is 59 years of age and growing in size and impact. We started in a warehouse. Even then, as we started in a warehouse, we've been in a constant state of high alert. That is the fundamental state of the school. From the 1968 riots to coronavirus, the state of the school has been to be ready and responsive, to deliver routine social work services and conduct social work research, and to answer the call of emergencies. Our faculty and staff have been essential personnel in Baltimore and across Maryland from 1968 to today. In this somewhat hard to read slide is a letter from then Dean Dan Thurs to Stan Weinstein, a member of the faculty or student body of the Graduate School of Social Work. He is traveling during the hours at the request of the Office of the Mayor in connection with the desire to reunite families separated by the recent discord and disorder. So in 1968, we were out assisting the community, helping families, and again in 2020. This letter now is being provided to you because you may need to commute to campus to perform an essential duty as it relates to the delivery of health care, essential research, or other support functions. So the state of the school has been ready, and the state of the school, as I first described in my 2013 State of the School address, is strong and is growing and is continuously improving and is planning and is cutting and tightening to make sure we get the most out of everything that we do. And we're working our letters off. In 2015, I described the state of the school as solid, expanding at University of Shady Grove and everywhere. We had 100 students there then, and proud of all that we were getting done. Balanced, and that balance was on the base of the history and culture of the School of Social Work and UMB, and it included education, community engagement and impact, financial resources being substantial and balanced, social work professions of evolvement and our commitment to it, diversity, equity and inclusion, and research. And still growing, especially with the massive expansion of the Institute for Innovation and Implementation. And in 2017, I described us as stretched and blending our cultures, blending our views, our work, research, practice, and service. We were blending. And in 2018, we were still balanced and even more stretched as we moved into yet another building and on edge and spinning even faster and blending even faster and stopping occasionally to celebrate our accomplishments and to celebrate the things that we were doing well. And in 2019, we had no state of the school. We took the time instead to focus more intently on the work at hand to improve the diversity, equity, and inclusion work in the school and to develop a strategic planning task force report last spring. And in 2020, we've been Zooming and WebExing cleanly and constantly. And we're even prouder as we've gone online in a hurry, and as we know, temporarily. From 1961 to 2020, we have ascribed to the idea that the social is fundamental. As discussed in the Grand Challenges for Social Work, the social is fundamental means that we understand the importance of our growth and our work because the social is fundamental to health, the social epidemiology of health. The social is fundamental to justice and social justice. The social is fundamental to education in the community school movement. The social is fundamental, and that's why we're here. And we have 3 pillars to our strategic plan. Education and lifetime learning is the first. We provide innovative instruction guided by social work values and science, which supports a community of lifetime learners. And how do we do that? Well, we continue to expand at Shady Grove, now up to 160 students with 2 emerging specializations. We do an enormous amount of continuing professional education through our CPE program. We had more than 4,000 attendees last year. We were recently approved by the Association of Social Work Boards to provide continuing professional educations nationally. And we're growing our certificate programs with a case management certificate program, one in substance use disorder treatment, and by relaunching the trauma treatment certificate with children and adolescents. And through the Institute for Innovation and Implementations, training, and others, we provide a huge number of training opportunities. The Institute provided more than 1,000 training events last year with more than 36,000 participants, just as an example. Our addiction response is growing. Before the pandemic, we were very focused on two of the other epidemics, community violence and addiction. We started this some years ago in refocusing our mental health concentration into one that was more broadly described as behavioral health, and lifted up the profile and role of addiction education and treatment. We began with a SAMHSA SBIRT grant, which is the screening, brief intervention, referral and treatment process, which is evidence-based. We followed that by a HRSA grant, a BWISE grant, which is to train our students for integrated health and behavioral health with a stipend program. Then a medication-assisted treatment spin-off from that included nursing and medicine as partners, also funded by HRSA. And now a substance use disorder intervention fellowship, we think the only one of its kind in the country, that's funded in part by the University System of Maryland, and now is going to be expanding, we hope, to other partners, including working with Morgan State students and Salisbury University, with state support from another Maryland agency. Diversity, equity, and inclusion. We try to align all aspects of School of Social Work policy, program, and practice with the goals of combating racism and all forms of oppression. Part of how we're trying to do that is to maintain a diverse student body. And in fact, our student body has become more diverse over the last decades. In 2001, when this chart begins, 64% of our students were Caucasian. Now it's down to about 53%. And we continue to expand in the diversity of the non-Caucasian proportion of the student body. And one of our aspirations is to make sure that those students feel included and all students feel included and have the content they need to work effectively in this diverse society to increase equity and address oppression. We've made significant curriculum reforms over the last 5 years. We've strengthened the current diversity infusion model by which diversity inclusion is integrated into every course. We now have a required full semester course starting in 2020 that will deepen students' ability to use social work practices to address disadvantaged and oppressed persons and communities. And we've added an online course, a one-unit online course that every student will take, basically as a prerequisite to coming into the program. And we hope that many faculty and students will take as well. And it's focused on the history of oppression of African-American people in Baltimore, but the message is much broader, and the thinking about addressing oppression and coming up with ways to resist it applies across a wide range of oppressed populations. Community impact and research. We are strengthening our community engagement, policy, practice, research, and technical assistance to achieve maximum social benefit. So our grant submissions have gone up in order to try to bring in funds in order to do that work and give that work more impact. Going back to 2012, we had 101 proposals submitted. That peaked at 192 in 2018, almost a doubling. And it's dropped a little bit to 135 in 2019, but we're not too worried about that. We also saw a peak of $120 million of requests in 2018, which has also dropped, but is still a doubling of where we were just 7 years ago. And the reason why we're not too worried about that is because we are asking for more funds and achieving more positive outcomes, as shown by our total research and training grant awards, which have continued to climb steadily even as we are operating today, and even with the results of submitting fewer grants, requesting fewer dollars, more are coming in. And we have now moved from a little more than $8 million a year to 45 million. One of those projects is funded by the CDC. It's a suicide prevention research project. It's led by Professor Jody Fry, and we have a video in which Dr. Fry is going to tell you something more about her Healthy Man Michigan campaign. Take it away, Jody.
When we've looked historically at how we've reached out to working age men, they've been one of the most challenging groups to engage in traditional mental health counseling. They also tend to be at highest risk for suicide, along with other risk factors like depression and substance use. So what we've been trying to do as clinicians and in the mental health field is not working. So one of the strategies with Healthy Men Michigan is to use tactics and ideals from other fields, from marketing and public health, to try to meet men wherever they might be in the community whenever they're ready. And to not talk about suicide and depression as mental illness and as disorders, but to frame it differently, to use stories of hope and resilience to help men understand that they have tools that they can use in their own repertoire to help themselves and help others, and actually to use humor. These were all things that men ages 25 to 64 told us that they wanted. The intervention we're testing is man therapy. So maybe the best way for me to explain what's going on in man therapy is for you to actually take a peek. And not for the faint at heart. Dr. Rich Mahogany tells it how it is, and he's a man's man. He uses a lot of humor to try to engage folks in a non-threatening way to think about, you know, am I struggling with mental health and what is out there for me? So let's take a look.
Men have a way of doing things. A man has his way of eating, of exercising, and of straightening up. So, when a man faces a serious life problem like divorce, depression, or suicidal thoughts, shouldn't a man have a way to deal with that too? Well, now he does. I'm Dr. Rich Mahogany. Visit me at mantherapy.org.
So that was just a quick snip to take a peek at mantherapy.org. Anyone can go and look at it. It's a public site. And what we're finding is men are really responding positively to not only the humor, but they're being prompted to seek help. In the Healthy Men Michigan study, about 40% of the men we've screened in Michigan are screening positive for suicide, and another 60% are screening at moderate to high risk for depression. The majority of those men that are going onto this site are not engaged in any type of mental health counseling. So man therapy is prompting them to not only take a look at what's happening with them, but to seriously consider reaching out to some of the resources that they might need. Some of the results that we found were, number one, it is really hard to reach out to men in their middle years about suicide and depression. So once we started to really immerse the marketing of man therapy and Dr. Rich Mahogany, the fictitious doctor that we're testing the intervention, men started to respond. We reached out to them on Facebook, Instagram, lots of press. I was on a sports show a couple months ago. So what we found to be most successful is just going out to reach out to men where they are. We can't wait for them to come into the doctor's office or to see a social worker, because that's not working, and men are dying at an exponential rate in this country. So sitting around waiting for them to come and seek help does nothing to change the stats.
Thank you, Jody. On the opioid response, we continue to develop new initiatives, and I just wanted to have you stay tuned for some of the things that are coming up in the school. One is we anticipate announcing 3 new grants for clinical research and training totaling about $7 million from the National Institute of Health and State of Maryland agencies in the months ahead to complement our current SAMHSA and HRSA funding. We also will be announcing a new behavioral health and well-being lab at the School of Social Work, which will be chaired by Jody Fry. One of the signature accomplishments of the School of Social Work over the last decade has been the development of Promise Heights. We began planning for Promise Heights as early as 2006, but didn't really materialize into any services until 2009, at which point Bronwyn Maiden took over and has led our initiative. And I'll let the video tell you more, but just to say that this is a long-term view. You don't change a neighborhood in a short time, but it is a long-term commitment that we're making, that we're trying to sustain, and that we will be studying to see are our methods effective in improving the cradle to career experience of an entire local community. Bronwyn and Promise Heights, please watch.
This small corner of Baltimore City had been the epicenter of African American life and development for decades.
You had a neighborhood that was historic in that you had a lot of people come from that neighborhood, including Cab Calloway, Thurgood Marshall, a number of others, Billie Holiday. And of course, we know what they've gone on to do in terms of changing really life in America.
But through the years of disinvestment, families in this proud neighborhood, rich and robust with history, have found themselves living in a community that lacks essential resources.
Where I live, it's nice, but the neighborhood, I don't really like it there because we have to hear gunshots a lot of times.
A strong and vibrant Baltimore requires children who are healthy, educated, and ready to enter the workforce. Yet in the West Baltimore community of Upton Druid Heights, 62% of children live in poverty, and more than 95% are not proficient in reading and math. Children are expected to achieve their full potential on their grit and resilience alone, while still facing many hurdles to their education. Inadequate schools, violence at home and on the street, stressed parents, limited recreational opportunities, and deficient health care.
The health indicators in this community show that a child born in this community would have a life expectancy of just 66 years. But if a child was born in Roland Park, they would have a life expectancy of 86 years. So there was a 20-year difference, and we're only talking about a distance of 4 miles.
Between 2005 and 2009, for every 1,000 births in Baltimore City, there was an average of 12 newborn deaths. One of the highest infant mortality rates in the country, higher than the rates of some developing countries. And in Upton Druid Heights, the numbers were even higher.
Our church, Union Baptist Church, has historically had a very good relationship with the University of Maryland, Baltimore, as well as the University of Maryland Medical School. There's been a healthy relationship. So I went there and talked to them.
We were looking at what could we do in the community, and specifically what could we do in West Baltimore in terms of really trying to change the outcome for children and families.
Through that partnership, a seed was planted, and what grew has saved lives and given hope to a whole community. Started by the University of Maryland School of Social Work, Promise Heights is a place-based program in this small section of the city, helping families throughout all stages of life.
With our pipeline of services, we really start with the beginning of life, so it's really cradle to college to career.
Promise Heights officially began in 2009 with Be More for Healthy Babies, an innovative initiative to reduce infant mortality in Baltimore. The initiative is funded by the Baltimore City Health Department and the Family League of Baltimore, and provides group-based educational programs and one-on-one case management geared toward policy change, service improvements, community mobilization, and behavior change. By 2016, the Promise Heights Be More for Healthy Babies staff helped reduce the infant death rate in Baltimore City by 21%, and in Upton Druid Heights by 43%. And between 2011 and 2018, Upton Druid Heights has had only one infant sleep-related death on record. Parent University is a 10-week program that provides young and expectant families with education and information on early brain development, health and nutrition, safety and discipline, stress management, and the importance of talking to their babies.
Once they got all the parents together, we did a lot of reading, circle time. Each week we make sure that you eat. The kids take home brand new books, 2 books every week. Parents even take away something.
You have a newborn, you need bottles, you have a 2-month-old, okay.
They always giving something away, and a lot of it have to do with knowledge. Teaches you a lot of about how to deal with your children.
I just had to be patient, and just make sure he's okay.
Parent University participants are also connected to workforce education, financial literacy programs, and even potential job opportunities.
we're able to hire many of the parents or some of the parents that really start working with us.
Miss Giselle graduated from Parent University. She became a parent mentor. She became a parent facilitator. She became an AmeriCorps member, and now she works for Be More for Healthy Babies.
So it feels really good, to myself to feel loved and respected in the community that I'm in right now.
I've said from my very first days in the school that society cannot be strong without a strong social work profession, and the social work profession cannot be strong without a great University of Maryland School of Social Work. And I think we have achieved that goal, but it has taken a lot of work, and I want to tell you about some of the things that we're doing. One of them is that during my years as president of the American Academy of Social Work and Social Welfare, which grew in a significant way under the school's tutelage and hospitality, we created something called the Grand Challenges for Social Work, which is a national effort that is supported by many other schools of social work and by leading social work organizations to address 12 grand challenges and to make progress on them and to embody the phrase that social progress needs to be powered by science. So integrating our social goals with science in a unique way. One of the other longer standing accomplishments of the School of Social Work has been its leadership in the nation and indeed internationally in the Employee Assistance Program field. We recently celebrated the 40th anniversary of the EAP program. Dale Massey, many of you may remember, was our faculty member here leading that, and she began it and took the school to national prominence, and her student Jody Fry has joined us and has maintained that prominence, and we were able to celebrate with other pioneers in the EAP field last fall in a great celebration that honored Dale and Jody and the School of Social Work. We're also celebrating the 10th anniversary of the Financial Social Work Initiative, which is to build financial capability for all, which is the name of one of the 12 grand challenges. So closely affiliated with the grand challenges, but independent. This work led by Meg Woodside, Jody Fry, with able assists from Christine Callahan and Robin McKinney, has also had a national impact. We're one of the cornerstone universities with regard to the development of this approach of doing more economic related social work, and we're very proud of that, and we know we're having an impact on other schools of social work and our clientele across the country. I could spend 5 states of the schools talking about our wonderful staff and faculty. Let me just tell you a little bit. One of them is that we now have, for the first time in the school's history, a University of Maryland School of Social Work Staff Council. Thanks to Christina Fenwick and to Sharita Adams for helping to get this organized. We now have an executive committee headed up by Sean Thornton. Also part of that executive committee, Shannon DeGrosse is our vice chair, Coretta McKenzie, the communications chair or officer, and Nakia Sherman, the secretary. We're delighted to have a staff council and know that they will help us to bring improvements to the school. We look forward to their messages and working together with them. There are many new staff in the school, and I want to just take this moment to welcome them without naming them. Many of them have followed in the footsteps of terrific faculty who have helped to carve the roles that they're in, but just as many are in new roles, are doing things that haven't been done before. And I wish all of them well, and please know that we will rely on you for the extraordinary advances that we expect will come our way as a result of having you in your jobs. We have 15 staff promotions, which again, I won't announce individually, but just to say kudos to all our staff who continue to make progress and to move up in our school and to find new challenges and new ways of contributing. In 2019, we did a massive search. We actually did several searches, and I'm glad we did, because this is not the spring to be doing searches. We hired 9 new assistant, associate, and full professors who are shown here, and who have already made significant contributions to the school. And we're just delighted by the way they have jumped in and taken off as faculty members in the school. In this year, 2019-2020, we've also been fortunate to hire 5 more clinical instructors who are working in areas of field, of telehealth and teletherapy, and substance use disorder and community schools. So we are delighted to have also added even more to a deep team of clinical instructors. I want to give a special shout out to Brenda Jones Harden, who we brought over from University of Maryland College Park. And we were able to do that because of a very generous gift from Allison and Arnie Richmond, the Allison Richmond Professor of Children and Families. Here you see Brenda being installed with her family and the Richmond family combined in a great event in the school. Brenda, it's wonderful to have you here. And also shout out to Corey Stema. Corey came to the school in 2006. She is she's been installed now as the Daniel Thurs Distinguished Professor of Social Justice, the second one in the school's history. She is a distinguished scholar, a brilliant teacher, international figure, and we are just delighted to have her in this role, and I'd be thrilled to watch her as she puts her stamp on the Thurs Professorship. I also want to mention for the first time publicly that we have 2 of our faculty who are being promoted to full professor. Ed Petrikonis, who's been an associate professor in the school for a long time and works in many areas, but especially in public health and social work and motivational interviewing and interprofessional education. And Bethany Lee, who has served the school as associate dean for research and works in children's services and with systems of care for children with serious behavioral difficulties. Please congratulate them in your own way. Give them a round of applause at home for this great accomplishment. And also, I'm very pleased to announce that 2 of our assistant professors have crossed the bar and become tenured. Melissa Smith, who does much of her teaching at Shady Grove and works in the area of the transition to schizophrenia and how to prevent that, and race equity issues related to mental illness, and Sarah DeBobna, who works in the area of autism and autism interventions. I'm very pleased to welcome them to the tenured faculty. There's so much recognition that I'd like to talk about. I have to really limit it. The first shout out is to Charlotte Bright. Charlotte, as of today, will be brought in as the president-elect of the Social Work Group for the Advancement of Doctoral Education, GAID. This is a very high-order position in the social work world, and not only is it great that Charlotte has been trusted as the leader of the PhD programs, basically, association in social work, but also this will make her a member of the Social Work Leadership Council that has the leaders of all the most important social work organizations. Also, I'm delighted to add to the honors that Jeff Greif, who has received other honors like Campus Teacher of Faculty of the Year, Teacher of the Year, has a new one, which is as a member of the American Academy of Social Work and Social Welfare, voted in by the current members of the Academy who recognize Jeff's extraordinary teaching and his scholarship and his lifetime contribution, and the fact that he's an important contributor to the American social welfare and social work scene. I want to recognize Carl Jackson, who is also recognized by the voters of Baltimore County District 8 to become a delegate. We welcome Carl back from Annapolis and hope he'll stay a while before he has to go back there and solve our fiscal challenges. We have award winners from the Martin Luther King Jr. Diversity Awards in 2019 and 2020. Sharita Adams in 2019 was the Staff Member of the Year, and in 2020, the Positive School Center in Swakos won the Faculty of the Year Award. What makes all this possible? Well, in short, all of you do. But there are certain mechanics that have to occur as well, and one of them is private fundraising. Thanks to our great fundraising team, headed by Dave Flinchbaugh, we have increased our fundraising over the years considerably. Our goal for this year is $4 million. We still hope to make it despite a few events out of our control. But what is in our control is the possibility of giving and helping to make this goal, which goes to support students, faculty, and community engaged intervention research. Part of that focus has been on scholarship. When I came to the school, we had 12 scholarships. Half of them were endowed and half of them were annual gifts. We now have 88 scholarships, the vast majority of them endowed scholarships, many of them by those of you watching this state of the school. So thank you all for your contributions. This makes a huge difference to our students and to who we recruit into our school. We take those scholarship funds and many other funds from the campus and from the grants that we've written to HRSA and SAMHSA and Title IV-E and the PhD assistance from that is provided by the campus and campus awards for diversity. And we bundle it all together. For the first time, we've crossed the $3.5 million award level. So we gave out last year 630 awards to students, and that amount of support is hugely appreciated by our students and by all of us. We have a new fund called the Student Emergency Fund, which opened just a few weeks ago as the financial impact of COVID-19 became more obvious. We have 190 plus donors already, many of them new donors. 64 School of Social Work faculty stepped up to contribute. That's just about everybody. So thank you, School of Social Work faculty. We are leading UMB amongst all the schools in the gifts that are coming in for their student emergency funds. We've assembled $25,000 in matching funds, partly from UMBF and other contributors, and we already have 35 requests for emergency funds from students and counting. I also want to take a moment to mention the Barth Professorship in Children's Services Research. I want to thank my wife, Nancy, for her willingness to participate in this and her generosity. My brothers, Gary and Paul, who have also stepped up and made significant contributions. So thank you for believing in me. For Jane and Stan Rodbell, to Arnie and Allison Richmond, to UMB and other foundations who have contributed, to the Board of Advisors and the Alumni Board who have also had many members contribute, and other students and research colleagues. I look forward to meeting the Barth professor someday. We've had great leadership in 2020 and years gone by. Marcy Kanai leading our Alumni Board, Howard Solins, the chair of the Board of Advisors, and Jay Unick, the chair of the faculty organization. I thank you all for your great work this year in a very challenging environment. And I want to thank, since a bit of this is a retrospective looking back, the others who have chaired the faculty, including Ed Pechakonis, Karen Hopkins, Jeff Greif, and Jody Fry. And also our other board leaders, especially Meadowlark Washington, former board chair, Steve Howe, former chair of the Alumni Board, and Stan Weinstein, former chair of the Board of Advisors. So I can see that some of you, well, I really can't see that some of you are getting restless, but I know you are, so I'm going to bring this to a close. First, I want to thank our stellar faculty. You make the school shine. I want to thank SWAG, SWIG, DIG, and DAG. Those are our internal organizations. Thank you for all you do for our school, and you know who you are. I want to thank our exceptional university partners for the amazing things that they do for the school and the leadership and example they provide. I'm deeply grateful for my chance, my spin at being dean here these 14 years, and all the ways that people have welcomed me and supported me and support the school. I'm sending you all a virtual hug. It has to be virtual given the circumstances. It's such a big hug that it's going to take a little while to load up and get out. And there it is. I hope you can feel the hug. So what's next for me? Well, I'm looking for role models to figure out how do I make this transition. And the first one I thought of, obvious choice, Shaquille O'Neal, who is having more fun in their second stage career in their preferment than Shaquille, and all the things that he's doing and sponsoring. So look for me on your TV and think of Shaquille, and you may see me in his entourage during my sabbatical. I might disappear for some times to get some mentoring. And also Stacey Abrams. At the Council on Social Work Education conference that we had, Stacey Abrams was talking about her unjust defeat as governor of Georgia. And what she said then, without any fanfare, complete humility, I don't have the title, but I still have to do the work. And believe me, I still have a lot of work to do as a faculty member to support our new dean and the ongoing success of this school. So now refreshments will be served next year by the new dean. You may even be able to get dessert from a new dean. Thank you for attending the 2020 virtual state of the school. Peace in and stay safe. Thank you.